Okay guys, now our next topic is the morphology of gastropathy and acute gastritis. So now let's break these words. The word gastro means something related to stomach, and the word pathy means the underlying pathology, which is irritating the normal function of stomach. And here you see the gastritis actually donates to word itis, which means the inflammation. So there is some kind of inflammation in the stomach in acute gastritis, which is not found in gastropathy. So the key feature differentiating between two of them is the inflammation. So now let's start the gastropathy. Moving on to the gross features, we found the mucosa of stomach may be hyperemic or swollen. So there is increased blood supply to mucosa of stomach, and it may look like swollen due to the underlying edema formation. But remember, these features may not be found in gastropathy. There is visible hemorrhage seen as the dark punctate areas, and between these areas of hemorrhage we found there is erosion of mucosa of stomach. So combined of these effects we found a new term, acute erosive hemorrhagic gastritis. This is the key feature of gross morphology of gastropathy. Now moving on to the microscopic features of gastropathy, we found there is moderate or mild edema in lamina propria. So look at this image, this illustration, and here is the lamina propria, and you will find there is mild or moderate edema in lamina propria. Also you see in the lamina propria you found there is a lot of blood vessels which are not usually found in the normal histological slide of lamina propria. Also you found there are some kind of changes in the mucosa of stomach, such as there is hyperplasia of the foveolar mucosal cells. So let me briefly explain the features of illustration of stomach I described here. This cell here is actually the foveolar cell. This foveolar cell releases the mucus and bicarbonate ions which neutralize the acidic environment in the stomach. And these cells are actually called the mucosal neck cell. It plays an important role in the regeneration of surface epithelium cells of the stomach. This one here is called the parietal cell and also known as oxyntic cell. It releases the HCl which causes the acidic environment in stomach, and it also releases the intrinsic factor which causes the absorption of vitamin B12. This one here is called the chief cells or the peptic cell or the zymogenic cell. It releases the pepsinogen which in the presence of HCl converts into pepsin and causes the active breakdown of protein in the food. And the last one here is known as enteroendocrine cell which releases the hormone gastrin. So in the gastropathy there is hyperplasia of these foveolar mucosal cells which causes the appearance of these gastric pits into something like a zigzag-like pattern resembling a corkscrew. So this is known as the corkscrew appearance. Now let's see the real histological image of acute gastropathy. So this is the real histological slide. Here you see this one here is actually the corkscrew appearance of surface foveolar cells, and below that you found there is a lot of collection of blood vessels, and there may or may not you find any kind of edema which is not shown in this slide. Now let's move on to our next topic, the acute gastritis. Starting from the gross features, so you have to remember that all of the gross features are same as that of acute gastropathy. So gross appearance is same. So now let's move to the microscopic features. So you will find that all of the microscopic features of acute gastritis is same as acute gastropathy, which is the moderate edema and slight vascular congestion in lamina propria, and there is hyperplasia of foveolar mucosal cells. But you will find an additional feature in acute gastritis, which is the presence of the neutrophils in the lamina propria of this acute gastritis. So there is neutrophilic infiltration which shows the acute active inflammation going on in this acute gastritis. So This is a histological image of acute gastritis, and you see all of the features are same as that of acute gastropathy except the presence of bunch of these acute inflammatory neutrophil cells found in this lamina propria and mucosa. So this was all about acute gastropathy and acute gastritis. See you in the next video.